Hello, my name is Betsy Webb. I'm the Superintendent of the Bangor School Department, and today I'm joined by Dr. Higgins, as well as Principal Al Mooers of the Downeast School. And today we'd like to share with the community a little bit about the dental clinic that will be open at the Downeast School. So maybe Mr. Mooers, could you start by sharing a little bit about what you know, and then we'll turn it over to Dr. Higgins. What we want our families to know is, we have this clinic in the school. Why are we doing the clinic? How can they access the clinic? And just really, what does it mean for their children?
We have about 70 students already signed up to receive the dental services from Dr. Higgins. A lot of those students came from an application that they filled out during open house last week in August. We also have forms here at the school that we can give to parents if they come in and inquire about how to get their daughter or son enrolled.
Are those forms easy to fill out, or are they complicated?
I think they're relatively easy. They look like forms that come from a doctor's office. When you sit down and take your child to the doctor, those kind of questions about health history and addresses and ages and phone numbers and those kind of things.
What if somebody has difficulty filling out the form? Do we have help here? Does Dr. Higgins, PCHC have help? What could families count on?
I think the families can count on Downeast to supply help filling those forms out. Mm-hmm. Any areas that we'd have questions on, we'd certainly turn it over to Dr. Higgins or our staff. Mm-hmm. Any technical kind of questions on the forms that we wouldn't know the answer to. And I'm pretty confident they probably review those forms somewhere in his office when they come in. Yeah.
And Dr. Higgins, have you been involved in a dental clinic in the school before?
Actually, I'm here representing PCHC, which is the Penobscot Community Health Care here in Bangor. And we have been involved with a school-based program in Brewer for a number of years, where we've had both professional hygiene staff and a dentist going to the school, working in an dental operatory that's been provided in the school for a number of years, and it's been a very rewarding experience and very exciting to be in the school. Schools are pretty neat places. A lot of energy. Your kids are just terrific to work with. They're a lot of fun, and we provide a service that we find has been kind of interesting in how it's evolved. Access to care, having a place where you can go for dental care or medical care isn't such a bigger problem as it used to be, but there are still barriers to that care. A lot of our patients in school-based programs have parents that are working parents that find it difficult to take time off from work to get their children to doctor's appointments, to dental appointments. A lot of them may only have one vehicle in the family, and that makes transportation very difficult. And so this is a change that I think is occurring across the country. There is a lot more attention to taking the service to the schools to ease those numbers of barriers to care that are out there. And we're very excited about being part of this program here at Downeast School, and we're working very hard to finish our dental operatory here in the school, and we'll be providing both hygiene services and dental services, including exams and cleanings, any fillings that might need to be done, dealing with any emergencies if any of your children have been having dental pain and that sort of thing. We want to be able to take care of that for them in the easiest, most convenient way possible.
And this is a partnership that we've had for a number of years. PCHC does provide us with our school physician oversight, and we had been looking at ways to provide dental care and to remove the barriers, as you have said. So we're just really excited to have it right here at the Downeast School. And I think that families will find that it's much easier, and that we know their children are going to be able to learn without having to worry about some of those dental problems that they've had, and that's very exciting for us.
We'll be providing a number of professional people here in this program. Your child, if they're enrolled in this program, will first be seen by the dental hygienist who will do a dental screening, probably take some radiographs, some x-rays, and at a time After that, probably the following week or so, I'll be coming as the doctor to review those x-rays, to do the complete exams on your children, and recommend care. Working with the folks here at the Downeast School, PCHC will have a staff person that will notify you as a parent of any needed work that your child has and make sure that they're available to answer your questions. And the way it's worked in the past at other sites, we've welcomed parents to ask those questions. If they have particular concerns, for example, your child's getting a little bit older, 9, 10 years old, and there's some concerns about development and orthodontic need. If you'd like, we can actually set up a time where you can come in and have a consultation with us, and we can explain some things in great detail to you. But the concept here is to provide really fine dental care for your child here in a place that they're comfortable, in a manner that makes it easier and more efficient to deliver for everyone involved.
Well, let's go back to some of the key dates. When will the clinic be open?
So I'm guessing probably within a week of time that place should be ready to go. And I'm not sure how much time the PCHC needs to set up appointments and those kind of things, but the facility, I think, will be up and available in a week.
I'm expecting that the hygienist will be here doing the first screenings by the middle of this month in October. I know that my first day to be here is the last Wednesday of October, which I'm sorry I don't remember the exact date on that, but that's when I'll be doing the first exams and treatment plans and getting to meet your children. And you'll be hearing shortly from us after that, should your child need some care and what that care would involve, and we'll be back to take care of it.
So, okay, I'm hearing the middle of October that the hygienist will be here, and the end of October as the dentist will be your first visit. Now, to clarify for the community, this is not Bangor School Department funding. PCHC was able to secure a federal grant in order to bring the dental lab into the school. We're going to use the nurse's office. And the billing, can you explain how that works, or if a family is worried about insurance? Because again, we're trying to remove barriers.
Mm-hmm. Certainly, if your family is covered by insurance, and those insurances range from private insurances to the main care program, that billing will be done through PCHC's billing department. Our goal is to reach the children of families that don't have a dental home. If you currently have a dentist that you're happy with, we want you to stay there by all means. We just don't want children to miss out on an opportunity of early preventive and early restorative care so that they can maintain healthy oral conditions. So that billing will occur through PCHC. If you do not have an insurance, if you're not on the main care program, then PCHC would certainly be dealing with you directly, and that all of that information will be gathered, and you can have that discussion with PCHC in that enrollment period, because part of making out all the forms is understanding if there are insurances involved, and if there aren't, and explaining what the costs could be.
Great. And maybe the last thing, if you could emphasize once again, Dr. Higgins, why is it so important that children have quality dental care when they're young?
Well, obviously, the first thing is we never want any of our children to be in pain. There are way too many children that go to school with teeth that are bothering them, that are distracting to them and take away from their ability to focus and learn at school. A lot of children, unfortunately, have ongoing infections in their mouths that certainly are not healthy for them in the long run. And taking care of this first set of teeth, this baby teeth that children, most of the kids in this school are still in the process of acquiring and or losing, has a huge effect on how well and how healthy your permanent teeth are when they come in. Dental disease is a preventable disease. And if we can get to these kids when they're young and provide some education, that's a huge benefit as well. And that's a big part of what our professional hygiene staff does.
Well, and I think the other thing is there's a lot that is in the literature about that good dental health also has an impact on your overall health.
And that certainly reflects as population ages. There are a lot of studies that indicate that good dental health can help prevent serious cardiac conditions, serious heart issues. And those are just examples of how a lifetime of good oral health pays off. What happens goes on in your mouth also has an effect on what happens in the rest of your body health-wise.
Great. Well, we're really excited to have you join us here at the Downeast School and to be in our school helping students as well as the dental hygienists and the PCHC staff. And for families and students, we're excited for you to have this opportunity, and please don't hesitate to call or to stop in if you have any questions. We want to make this a program that is accessible to all. Thank you.
Thank you.